Hi, I'm Dave Worsley, and you're watching PHTV4 Living Well. And on Living Well, we take a look at a variety of topics related to living a healthy lifestyle. Today, we're going to take a look at dental care. And to look at this topic, we've got Dr. Brian Gamble here with us from Gamble Dental. Doctor, thank you for being here.
Hello.
Thank you for being back. You've been on before, and it's always fun talking to you. Very, very helpful. Today, we're going to talk about something I think very important, potentially very, very unpleasant too. I want to ask you about plaque, and I think it's related to gingivitis, gum inflammation,
Yes.
right? First, can you tell us, what is plaque? How does somebody develop plaque on their teeth?
Okay, first there's a biofilm on the tooth that we always have. It's called a pellicle. So over time, it can form like a sticky substance. And if it's not removed routinely, that's where plaque develops. Plaque is a soft, sticky surface or substance.
All right, so I'm with you on how it happens and the description of it. Why is it potentially a bad thing? What's the risk in
What happens when there's debris on the teeth, that causes inflammation within the gums, and that's what we consider gingivitis. Gingivitis is basically inflammation of the gums. So with the removal of it, it keeps the tissue healthier, which keeps our whole system healthier.
All right, we don't want plaque in our teeth. All
Correct.
Right. How did we develop plaque? How does that end up happening? How does it grow in our teeth?
I think it's more just through the biofilm.
Okay, all right. All right, now related to that, so I'm going to ask you, we definitely don't want this. What can we do to decrease the risk of plaque buildup? Related to that down the road would be, all right, well, I've got it. I'm starting to have gum issues now. How do I treat that?
What to do?
Yeah,
Yes.
How about the plaque first?
Well, the plaque is just routine removal, which is brushing and flossing the teeth. That's really critical to the whole situation. So when we're talking about biofilms, we're eating and drinking and all these materials can attach to that film, and that's what grows the plaque. So if it's not removed routinely, then it turns and mineralizes into tartar. And at that point, tartar is harder to remove. So that's where coming to the dentist regularly, things like that, we can break this up. It grows underneath the gum line and can do a lot of damage ultimately, if not treated.
So that would be the next. So it sounds like with addressing it regularly, we might be able to avoid it all completely.
Yes.
Right? All right, let's say, unfortunately, I haven't been able to stay on top of it, and then we do get to the inflammation. What happens next?
At that point, I mean, when you're coming in for a cleaning, we do an assessment that way with the periodontal tissues and see at what level we're at, whether it's just inflammation or is there accompanying bone loss associated with it. Bone is what holds the tooth in place. And as you get plaque, that causes the inflammation, but if it mineralizes, then it becomes tartar, and at that point, tartar can release a toxin that melts away some of the bone in localized areas. So that's why brushing and flossing is so critical to the situation, just to break it up.
Okay, and that was going to be my final question for you then. So how do I avoid plaque and gingivitis, and obviously the tartar thing, and I like you dropped the word toxin in there, you grabbed my attention. So it sounds like the standard treatment. See your dentist regularly, get the plaque off your teeth, brushing, flossing, any other maintenance advice, or maybe dietary, I guess.
Well, dietary is always a consideration with the sugars and things like that. But really, good maintenance is the best way. The brush, floss, and then see your dentist regularly. It'll really break things up. You can use rinses for the tissue. Listerine's a good rinse. There's other ones on the market. Closis is another one. It's chlorhexidine is a good one. So there's several different rinses you can use, a lot of over-the-counter.
And you're talking about regular maintenance schedule with those items, right?
Yes.
Okay.
Yes.
All right. All right, well, thank you very much. I appreciate the insight into how it develops, but also, how we can avoid it or treat it once we're dealing with it. Thank you, Dr. Gamble.
You're welcome.
I'm Dave Worsley. You've been watching PHTV4 Living Well. We've been talking with dentist Dr. Brian Gamble of Gamble Dental in Palos Heights. Thank you for watching, and be healthy.